it's more likely to be a facet that's inflamed, and that's going to create a referral pattern. So why are those so often mistaken? They come to you, they're like, I've tried this epidural and I've tried this care, and then in the end you're like, yeah, it's because they're treating the wrong space. It's a facet that needs to be
Yeah.
treated. So why does that happen so often? Do you feel like that's confused?
I think honestly it comes down to the medical community. Us doctors, sometimes I think we use terminologies interchangeably without understanding, like without sticking to a true definition. So sometimes a patient come to me and say, well, the doctor told me I have sciatica. And I'm like, so tell me what that means to you. And then they start talking about their hip. And I'm like, the patient interpretation of their pain might be misunderstood. So sometimes spend the time to try to truly understand what does that pain mean to them. That's one component. The second component I think is we rely heavily these days on imaging studies.
Yes.
So the first thing we're going to look at is an MRI, and we are programmed to look at the disc. Our first suspect on any MRI is always going to be the discs. And so if we find a disc bulge or a disc herniation and the report says 2 millimeter here, 3 millimeter here, we think the disc is inflamed, to your point, and now we think it's going to be a radicular symptom, so let's do the injections.
Yeah.
And I find it interesting because when I started doing personal injury, it was very rare to actually see the radiologist commenting on the facet joint in terms of facet joint effusion or edema.
Yeah.
Things have changed, and now we see more reports focusing on, or at least paying attention to the facet joint, which help aid with the diagnosis, which obviously help aid with proper treatment.